Come in.
Hi, my name is Jaden. I'm going to be your student nurse today. I'm going to start by providing privacy and performing hand hygiene. Can you verify your name and date of birth for me?
Yes, my name is Haley McLaughlin. My date of birth is 030403.
Okay, and can I check your armband?
Yes.
Alright, good. It looks like we're here for a head to toe assessment. I'm just going to verify my orders real quick.
Alrighty.
And yep, there they are. So I'm going to start at your head and then I'm just going to go through every single little system, okay?
Alright.
Alright, starting out with your head, it appears symmetrical. Your eyes are symmetrical to your face, your ears are symmetrical. I'm going to look at your scalp, and that looks fine, your hair looks fine, you look well groomed, your dress is appropriate, and your skin tone is appropriate for your ethnicity. I'm going to start and check your eyes, alright? I'm going to flash you with a light. Alright, and you are sitting at about a 4, and you can drop down to about a 3. Okay, do it one more time. Alright, and then can you just follow the light or the pen? Your pupils are equal round, reactive to light and accommodation. I'm going to come over to here to your ears. Do I have permission to touch you?
Yes, ma'am.
And I'm not seeing you have normal wax. Okay. And I'm going to check your nose. And all that looks good. And then can you open your mouth and say ah?
Ah.
Good. Alright, I'm going to rapid fire some questions for you.
Alright.
A few of them may seem silly. Can you tell me where we are today?
Yes, we're at the clinic.
Alright. And can you tell me what year it is?
It is 2025.
And who's our president?
Donald Trump.
Okay. And then have you had any history within the past 6 months of head trauma, head injury, anything like that? Have you had any issues with migraines? Have you noticed any changes in your vision? Any changes in your hearing?
No.
Do you find it difficult to swallow?
No.
No sore throats? Okay, I'm going to feel your trachea right here, and your trachea is midline. Can you swallow for me? Okay, good. All right, now I'm going to move on to your cardiac. And I'm going to listen to 5 points on your chest. And then I'm going to check your capillary refill in your hands and your feet. I'm going to check 3 pulses. And I'm also, while I'm at your hands, I'm going to check your skin turgor.
Okay.
Can you lift your breast up for me?
Yes.
Come down here. And then come right here. And that was your aortic, your pulmonic, your Erb's point, your tricuspid valve, and your mitral valve. I just auscultated. Okay, I'm going to check your hands for capillary refill. I'm going to check for edema. No edema. Your capillary refill is less than 2 seconds. And I'm going to check your skin turgor, and that just snaps back into place. Same with this one. Less than 2 seconds. No evidence of edema. It snaps back into place. Now I'm going to come down here to your feet. Actually, I'm going to do your radial pulses real quick.
Okay.
And both of them are palpable, and I'm going to rate them at a 2+. All right, and then down here at your feet, it's less than 2 seconds. No evidence of edema. All right, and now I'm going to feel your dorsalis pedis pulse. It's palpable at a 2+. And then your posterior tibial. also palpable at a 2+. All right. Have you had any family history of heart disease, hypertension?
No.
No? Okay. I'm going to now do your respiratory. I'm going to listen to 4 spots on the front, 4 spots on the back, and then 2 on the sides.
Okay.
When I put my stethoscope down, just take a deep breath in and out for me, okay?
Okay.
Can you lift your breast up for me, please? All right, and can you put your arm across your chest? All right, and stand over here. Okay, and now I'm going to come behind you.
All right.
Okay, your breath sounds are clear and even bilaterally. Have you had a cough recently? Not coughing anything up? Okay. If the need were to arise, I'd like to take this time to provide a little bit of education. There's this thing that we have called an incentive spirometer. It's used to expand your lungs, help expand it and all of that. And you would take the nozzle, put it in your mouth, inhale for 2 to 5 seconds, and then release, and you would do it 10 times an hour. Can you repeat that back to me?
Yes. So if I wanted to expand my space in my lungs, I would hold it up to my mouth, inhale, exhale, hold for 2 to 5 seconds, and repeat 10 times an hour.
Okay. There is also this thing called turn, cough, and deep breathe. If you were to have like issues with coughing up stuff, and you would, if you're in bed, you would roll onto your side, you take a deep breath in, and then you would cough, like a really good cough. And you would do that until you have gotten everything up. Okay. I'm going to now move on to gastrointestinal. Typically, the patient would lay back and I would lift their shirt up and inspect it and do all of this, but we have a chair today, so that's what we're gonna do. So simulating that I've checked out your stomach, now I'm gonna listen in 4 quadrants, okay? Okay. There's bowel sounds present in all 4 quadrants, and all vascular sounds sound good.
Okay.
I would also, again, client would be laying down, but we would softly press on the abdomen and palpate for any masses or anything like that. Your abdomen is soft and I'm not feeling anything.
Okay.
Have you had, when was your last bowel movement?
This afternoon.
Okay. And have you been experiencing any stomach pain, any trouble when it comes to having a bowel movement?
No.
Okay. And then moving on to your urinary system. When was your last period?
I have an IUD, so I don't have a period.
Okay. Genitourinary. And have you noticed any trouble when it comes like to pee, or any burning, any trouble peeing?
No.
Okay. Now I'm going to move on to your musculoskeletal system. I'm going to assess your range of motion.
Okay.
I'm going to start with your elbows, so I'm going to show you how to do it at first. So holding your arms out like this, can you flex up and then extend back down? Okay, now I want you to do that again while I'm holding. Flex up and down. And I'm not noting any crepitus while you do that. Same with I'm gonna do your wrists. Hold your hands out like this. I'm gonna have you flex them down, extend them, and then hyperextend them. And I'm gonna have you do that while I hold your wrists.
Okay, so flex
Down, extend, and then hyperextend. All right, and no crepitus notice there either. Down for your feet, I'm going to, or your lower extremities, I'm going to have you we're gonna do your knees and we're gonna do your ankles, okay?
Okay.
With your knee, I'm going to have you flex it back and then extend it.
Okay, I'm gonna stand this part.
Okay.
So, flex it back.
And then extend. All right, and now do that while I'm holding it.
Alright.
And then extend. Same for this one. Alright, and no crepitus noted there. You can sit back down. And then with your foot, I'm going to have you dorsiflex. No, plantar flex. And then I'm going to have you dorsiflex. Okay. Now can you do that? Alright. And then plantar flex. And then dorsiflex. And there's no crepitus noted in either one of those. Now I'm going to test your gait and your balance.
Okay.
Alright, can you stand up and walk towards me?
Yes.
Alright, and now you can walk back. And now I'm going to have you close your eyes and just stand here for a little bit of time. I'm going to have my arms out like this.
Okay.
So starting now, go ahead and close your eyes. And I'm not noting any like balance issues. You can open your eyes again. Alright, I believe that would be it. One more thing before we go that I forgot to assess. Going back to your neck, I want you to sit back down. Can you tilt your head back and to the side? Okay, and then that one. And no JDV is noted. Alright, I believe that is it.
Okay.
Is there anything you have to ask me?
No, I'm good.
Alright, thank you so much.
Alright, thank you.